Okay, welcome. Good morning. Thank you for coming to this kind of early morning session. We really appreciate it. Great to see you all. So we're going to talk about strengthening menstrual health monitoring, and we're going to look at some lessons from pilot countries and maybe start talking about how we could all kind of get on the same page and have global alignment for global monitoring of menstrual health and hygiene. So I wanted to start with a video from Francesca Mazzola from the Gates Foundation. Maybe. This was working 2 minutes ago. Let's see. There we go.
Hi everyone, my name is Francesca Mazzola and I'm a Deputy Director at the Gates Foundation leading our menstrual health work. I am so sorry I couldn't be there in person with you today, but I really wanted to take the opportunity to, one, welcome you to this session, and two, share my deep excitement for the work that is being presented. At the Gates Foundation, we believe deeply that what we measure shapes what we prioritize and ultimately what we change. And for far too long, menstrual health has been missing from the data that drives global decisions. Without clear, consistent indicators, the experience and needs of millions of women and girls has remained invisible. And that's why we're investing in this work. It's not just about the numbers, although we care about the numbers. It's about the visibility, the accountability, and the equity that these numbers and this data can drive. Reliable indicators can transform how governments, donors, and organizations understand and act on menstrual health, ensuring that the resources flow where they are most needed. And this moment feels particularly critical after years of progress and hard work, driven by many of the people in this room who have built the evidence base, expanded on key programs, challenged the stigma associated with menstrual health. We now have global indicators that are embedded firmly into global health and development frameworks. By strengthening how we measure menstrual health, we strengthen our collective ability to drive change. I am confident that with this work, we are going to have a significant impact. I'm looking forward to hearing how this conversation goes and how we can continue to work together. Onward.
Great. And with that, I'll hand it over to Mariah, who will give us a session overview.
Sorry. Hi, good morning everyone. So good to see you all in the room, and really inspiring words from Francesca this morning. We all get inspired by her. So today we're going to talk about menstrual health monitoring and the lessons from pilot countries and pathways to global alignment. So this is our agenda for today. So after the session overview, we'll have an update on the progress on global monitoring on menstrual health and the lessons learned from the Mix 7 module by Christy. And we have lessons learned from Mongolia and Pakistan, who have actually been implementing the Mix module. And then we also have a presentation on the global priority indicators for girls on menstrual health and hygiene from Marnie and Bethany from Aim High. And then we're going into group work discussions, and you'll get more updates on how that's going to look like when we reach that stage. We'll have some reflections, and then we close at 10. And then it's time for coffee. All right, so before I go to the session objectives, I just wanted to say a big thanks to all the partners that we are co-hosting the session with. So it's, of course, WHO UNICEF Joint Monitoring Program, it's Aim High, the Global Monitoring Group, it's UNICEF, but also the Gates Foundation. Francesca couldn't be here in person, but she was able to send a video and welcome you that way. So thank you to all. So, and she actually already said this, but I did want to put up the nice cartoon, and thanks to Christy for plugging this into the slides. It's always really nice to think about monitoring in a fun and silly way. So why should we monitor menstrual health and hygiene? So if we don't monitor it, we cannot improve it. But what do you mean? Well, monitoring data are needed to inform advocacy policies, costing and more to support improvement. But why is it important to improve menstrual health? Well, I think you would all know the answer to that. But the girl here says, well, menstrual health is central to achieving multiple SDGs, fulfilling basic human rights, including those related to health, education, work, housing, and WASH. And there are over 2 billion adults and girls and women of menstruation age in the world who are counting on us. So let's help them to make sure that their menstrual health needs are met. What are we waiting for? Let's go and monitor. But what and how should we actually be monitoring? And that's the big question, and hopefully we get closer to an answer today in the session, because we're going to look at understanding the structure and the content of the Mix 7 menstrual health and hygiene module, and also looking at the relevance for global menstrual health monitoring. We're going to learn from experience of implementing this module, but also of the AIM high priority indicators for girls. We're going to discuss some of the technical challenge of data collection and use, but also look at opportunities to improve this data collection, the indicators, and gap filling. And then lastly, we identify concrete actions to strengthen the coordination and the data use across stakeholders. So that's the session for today. And with that, I'm going to hand it over to Christy to take us through the mixed module.
Thank you. I'm back. All right, thank you very much, Mariah. I'm going to talk about progress that we've made on global menstrual health and hygiene monitoring to date, and also specifically some lessons that we've learned from the 7th round of the UNICEF Multiple Indicator Cluster Survey, or MIX. So I want to highlight the increased attention that we've seen on MHH recently, and also highlights from lessons that we've learned and how we've evolved monitoring globally, how we've learned and adapted, and then what the data that we have right now are telling us, and lessons that might help us inform where we could go next. So the Joint Monitoring Program is responsible for monitoring SDGs 6.1 and 6.2. And starting in May 2011, we had expert group meetings and consultations to discuss what monitoring these indicators are going to look like, what are the actual targets, and MHH was a big part of these discussions, especially with the language in SDG 6.2 that you can see on special attention to the needs of women and girls. So this led to proposals in 2014 about what we should be monitoring, and part of the outcomes of that was in 2016 there was a pilot in Belize working with UNICEF Mix around what the questions should be for monitoring 6.1 and 6.2, including 4 questions on MHH, which is really exciting. This is like integrated into an international survey program almost 10 years ago. So those questions include impacts. Did you have any days where you missed social activities, school, or work due to your last period? There was a question on facilities. Were you able to wash and change in privacy at home during your last period? And then another on materials. Did you use materials such as sanitary pads, tampons, or cloth? And these were the questions that were really meant to be tracked. They're linked to indicators. And then the last one isn't really an indicator. We're not trying to push women into using reusable material, but for information, they included a question on if women are using reusable or single-use materials. And we saw other international survey programs like the USA Demographic and Health Survey, DHS, PMA 2020. They also adopted MHH questions. There's more program monitoring, and then research, including by a lot of people in this room. So we've really seen increased attention. And you see that here as well. The JMP had a dedicated chapter on MHH starting in 2021, and we already had some data on those 3 indicators that were included in the Mix 6, materials, private place, and then participation in activities. We also included a 4th indicator based on the Global MH Monitoring Group's suggestion to look at data that might be available on awareness of menstruation before menarche. And we did find data, even back in 2021, from 2 countries, Bangladesh, and Egypt. So these are these little baby bars here, but there was something. And we saw in our 2023 report that there was an increase in the number of countries with data for these 3 indicators that were in the mix 6, but not a lot of improvement on awareness, because that question wasn't integrated into an international survey program. But as I said, this is an evolving process. So if we look at the highlight data from 2023, I think there's some things that informed potential changes that we've been working on. So one is, you'll notice for use of materials and private place to wash and change at home, the darker colored dots, a lot of them are very high, like 99%, 98%. And when you talk to people that work in the field, they're like, that doesn't seem right. I don't think that's quite, the picture isn't really that rosy. So maybe we don't have sensitive enough indicators. And if we look at the lower values for the 2 countries that had data on awareness, that kind of highlights this, maybe that was a more sensitive indicator. We're starting to identify challenges. That's something we might consider for future global monitoring. And then in 2021, Julie Hennigan and a number of people in this room finalized a definition of menstrual health, and it included some key components that weren't reflected in these 4 indicators. So another thing that maybe would inform improvements. So in 2022, the JMP convened an expert group on MHH monitoring, including folks here, so thank you. And the goal was to come up with questions and indicators that were useful, comprehensive, validated, comparable, including at least somewhat comparable with the questions that we were already asking, and simple. So as a group, we looked at lessons from the Mix 6, DHS, PMA 2020, and then a really big influence for what came out of these discussions was the now AIM-HI's priority indicators for girls MHH, which is based on a ton of experience and validated questions as well. So this group recommended 6 indicators and questions for MHH, for household surveys specifically, and these were adopted by Mix 7, and they're now in a complementary menstrual health and hygiene module. So a shift from Mix 6 to Mix 7 is Mix 6, everything was in the core questionnaire. It went to women age 15 to 49, and all the questions were there. It's a really big interview. In Mix 7, they switched it, so the core questionnaire is much shorter. It includes some of the basic wash or foundational wash questions, but a lot of topics got moved to optional complementary modules, including MHH. So, the positive side of this is we can add more questions. We got 6, there was 4 in Mix 6. But, little increase, we'll take it. But we do need to advocate for its inclusion. So the more data we have, the more we can show that it's useful, the more likely countries will opt into this module. And so those 6 new indicators you'll see on the right side here, and these were the focus areas for the chapter on MHH in our latest household report that came out this year. And so you'll see we kept the awareness of menstruation before menarche question. We modified, instead of looking at use of menstrual materials, it's enough menstrual materials to change as often as you wanted in your last period. For a private place, the question, instead of asking women directly, do you have a private place at home, it really focuses on, were you worried someone could see you? And that was based on a lot of research done by folks in this room and Julie Hennigan. For participation, instead of asking about attendance, it's, do you have trouble participating in school? And we separated out school, work, and social activities. So now we can track those separately, which we couldn't before. And then looking at the definition of menstrual health and suggestions from the AIM-HI group, these last 2 are brand new: ability to reduce menstruation-related pain and comfort seeking help from medical providers. And if we look at the new data, so this is the previous graph, those data are still there, but now we've added the new ones. And you see, based on new definitions and the new indicators, we're seeing a little bit more sensitivity lower values. It might be more reflective of the actual experiences of adolescent girls and women. And we already have some data on these new indicators. Ability to manage pain, we had data from Mongolia and Ireland. Comfort-seeking help from Mongolia and Canada. And then on enough materials, there were 6 countries with a caveat. We don't have harmonized data yet within those. Some of these definitions vary. We're still working on harmonization. But there's a starting point. Mongolia, I don't know if you can tell, but they have all 7 because we kept use of menstrual materials in addition to the 6 new ones, because they're the first country that did the Mix 7 and had publishable data that was ready for our household report. So they've got everything. Awesome. So I mentioned that Mongolia had all of the indicators. There are additional countries, 4 other countries, and then 2 districts in Pakistan that had already implemented the Mix 7, but their data were not yet publishable. But it's an opportunity to kind of look at what are the data showing us already, and these are averages of those 5 countries and 2 districts because the data can't be shared yet. But we met, a big group of us met in Rome earlier this year and went through these emerging data and some of the lessons from the countries that have implemented Mix 7 to kind of talk about what's going well and what's not. So if we look at the data, you'll see, values are much lower. There's more spread between countries. This is kind of what we would expect until we get to had enough materials. Very high, 88% was the average, and not a lot of variation between countries. So we've been working with the AIM High group to modify the questionnaire, modify guidance for Mix 7, and try and make sure that that's a really understood question and is sufficiently sensitive. Some other lessons that came out of the Rome meeting were around training and data collection. People really highlighted the importance of training enumerators, making sure questions are understood, really spending time on role-playing and peer-to-peer learning, what's going well. Data dissemination came out as something that I think we can do better, and we'll talk about ideas for that today. MHH is so it's such a cross-sector topic, but how do we actually coordinate between sectors, which kind of gets to number 4 here. How do we make this framed in a way that it supports advocacy in different sectors? And then the third one, complementary data. Mix 7 provides a great harmonized foundation, but we really need research to dive deeper into things and to fill some gaps. For example, what about age 10 to 14? They're kind of left out of Mix. So we're also going to talk about that today. What are some ways that we can fill those gaps? Great. And then the last one here, evidence. We may need to really show the value of MHH. Maybe we need return on investment data, cost of inaction data, making sure that countries prioritize this, get that module included in their mix, but also collect data in other ways, act on it, start making these improvements. And country examples of how data are being used can be really helpful, and we'll hear from Mongolia and Pakistan today with some examples. So I don't have answers to these questions, but I'll leave you with 2 questions that I think we can all work together on. How do we build on these experiences so that we can monitor better? How can we keep improving and learn? And then how do we use the data better so that the people we're trying to improve their lives, it's actually improved and the numbers don't just sit in a database somewhere. So I'll leave you with that, and then I'll stay up here just because our next speaker is a video. Kugi couldn't make it from Mongolia, and the time zone to Mongolia is really rough. So we'll listen to her video, and then Ashraf from Pakistan is online, and we'll have a presentation from him after.
Good morning, colleagues and members of the Global Monitoring Group. It's an honor to join you at the Water and Health Conference and share Mongolia's experience in advancing menstrual health. Your commitment to improving data and equity in water and health outcomes is truly inspiring. Menstrual health is essential to women's dignity, well-being, and participation in society. Since 2017, Mongolia, led by the Ministry of Education, has worked to improve menstrual hygiene in schools and dormitories. In 2023, we made a major leap by listening to over 8,000 women aged 15 to 49 through the multiple indicator cluster survey. The new menstrual health module in MIG 7 offers valuable insights into current needs and gaps. To set the scene, Mongolia covers 1.56 million square kilometers with a population of 3.5 million. About 33% live in rural areas, and to support children from remote communities, over 526 dormitories house more than 35,000 students, and many for up to 9 months a year. And here what we have learned. 98% of women reported that they had enough materials during the last period. This is a strong result, unexpected, and though rural and poorer communities need continued support. And perhaps here we need to adjust the questionnaire and detail out what the materials means and to understand more the access to materials. 6% of women worried about privacy when changing materials at home. This is encouraging, but rural areas still face challenges. 24% could relieve menstrual pain when needed, showing a gap in access to pain relief and education. 81% felt comfortable approaching health providers, especially urban and educated women, reflecting trust in health system, but we still have some 20% gap here as well. 65% knew about menstruation beforehand. Younger women were better informed, showing progress in education and health education in particular. However, 1/3 had no idea or knowledge and understanding before the first period, which we must ensure that every girl is prepared. 27% said menstruation affected their work, education, and social life, especially young women and those with disabilities, demonstrating serious gaps for disadvantaged groups of population. In terms of the lessons learned, the module structure worked well in Mongolia context. Interviewer training is crucial, especially to understand activity categories across rural and urban settings, overall customization to the cultural and contextual discrepancies and specificities. Seasonal changes affect access to resources, and therefore whether the girl lives at home or in dormitory can influence availability of resources as well. And these type of dynamics perhaps also need to be captured in this type of surveys. In closing, menstrual health is not just a personal issue, it's a public one, and let's continue to break the silence, improve access, and empower every woman and girl to manage menstruation with dignity. And together, we can make menstrual health a reality for all. Thank you very much, and all the best to the conference.
Great. Thank you. It's always so awkward when there's a video. I want to clap, but I'm like, oh, she can't. Great. Atraf, can you hear us?
Yes, can you hear me?
Wonderful. I'm going to move your camera to the screen so that we can see you. Is your camera working still?
Yeah,
Okay,
that's
great,
fine.
perfect.
You can-
Let me know when you want me to change slides.
All right. So good afternoon, colleagues. This is Asha from Rabbit, Data Analytics Manager, UNICEF, Pakistan. So through these slides, we'll try to give you an idea or overview of experience of Pakistan in two provinces, in Punjab and Gilgit-Baltistan, about the implementation of MHH model. So can we move to the next slide? So an overview first about this, the mix 2024 in Punjab. So the mix 2024 in Punjab is district representative indicator for children and women with a very huge sample size. It's around 50,000 households. It's implemented by the Bureau of Statistics Punjab with UNICEF technical support. So this, for MHH information, this is the second time collected. We started by the mix 2017-18, and this is the second time. So part of the information can be compared, and the other one are new and mix 4. Can we move to the next? So for Gilgit-Baltistan, it's a region. It's not a province in Pakistan, but it's the same. It's also district level representativity for all the indicators that we have. Is the household is around 7,000. It's implemented by the Planning and Development Department, and UNICEF as well provided the technical support. The good news that this is the first time that we are collecting MHH information, and we are expecting that this dissemination of the finding December this year. So that's why we will not be able maybe to share with you the latest finding of this mix. Can we move to the next? So the key finding from the mix 7 in Punjab. So we have the graph, you can see it maybe on your left or on your right. So only out of women 15 to 49 years, only 20% knew about the menstruation before the first menstruation period. 61% would feel comfortable seeking help from the healthcare provider, and 71% were able to reduce pain. It's only also 67% reported that they didn't worry. Someone would see them while changing materials at home in mix, and almost half reported that they did not have trouble participating in work, education, or social activities, calculated from the 3 separate questions. So for the impact or the no trouble, as you may see that the highest one is more on the education and the training, and the lowest one is on the work environment, during the work environment. So we move to the next. We digged more, or we dived deep more on the data, and we try to see together how is this percentage varies across the different age group. So the first one is we took the big age group, which is the 15-49 years old, right? So the knowledge, as you may see, is still 20%, right? And if we go to the next one, so the 15-19, we have very slow or slight improvement regarding the knowledge, which is something that is so a bit alarming for us for this age group of 15-19, right? The third age group, which is the 40-49s, so you may see that situation maybe is quite different from the 15 to 19, especially, as I said, maybe related to the impact and also on the facilities, right? So we move to the next. So few, to be honest with you, key lessons on the training and data collection of this model. So this set of questions are the models that we have. So we use it without any change. When we got the briefing from the enumerators of the fieldwork staff, they reported no issues on the understanding of the question or the flow of the question. So there is nothing significant issues in terms of implementation of this model. As a mixed program, the standard that we use the female enumerators, and this has facilitated getting information from the female respondent, girls or women on advanced ages. Again, one of the key instruction that we give to the enumerator is to maintain privacy, which has helped a lot in terms of ensuring a smooth implementation. Next. So on the data analysis use, so the first mapping that we did for the first MHH information, we didn't see like a big crowd around the data or the finding that was disseminated on 2017-18. And this is maybe the issue, or this is due to the fragmentation of the lack of coordination between the producers of this information and the users, right? So it's like maybe most of the country, you have the Bureau of Statistics who are producing the data or conducting household surveys, and you have the line department, concerned line department, who will be using the data. So that link or the bridge maybe is a bit weak. And this is also something that UNICEF is going to play a more critical role on facilitating this. So this is the new data for Punjab, more data. The first initial discussion that we have when we had our workshop with them, we had a workshop to discuss the results. They said with the government, we agreed that we're going to have a consultation workshop, but they call it the round table around to discuss the results. For the time being, this consultation workshop or the round table is postponed not for next year, but this is at least will be the first entry point to start discussing the MHH information, also the different disparities that exist in the province of Punjab. More, this will be also opportunity to involve all the stakeholders concerned by that, education for the schools, planning and development as the one who's have the authority of numbers in the Punjab, and social welfare and the other relevant departments. Again, there is no kind of group or platform to discuss this type of information, and this is maybe would be the first maybe recommendation that we're going to put to the table on the table while we're going to have the roundtable. Next. So Pakistan doesn't have a national level estimate, unlike the other countries, because of the unique model of the mix. Mix is implemented in different provinces. We have 4 provinces and 2 regions. We have Punjab and GB mix, and the plan next year, we have very concrete and firm plan to conduct the mix in KP province and Sindh and Balochistan. So we're going to have 5 or 6 values. We'll be able maybe to come up with an estimate. However, there is opportunity again, since the Pakistan Bureau of Statistics in 2026, next year, they are planning to conduct a demographic health survey. And the intention from UNICEF, from our side, is to propose that this model would be on the demographic health survey. Our rationale is clear. We don't have this.
Atraf, can you hear us? Did we lose you? I see that you're online, but I don't know if you can hear us.
If you can, maybe you can turn off his video.
It's off, yeah, his microphone's on. Maybe we can go to your presentation and then come back. Is that okay?
We love Asha.
Yeah, he just popped off, so my guess is it's an internet issue. If y'all don't mind, sorry, we might pause Ashraf's presentation and then we'll come back. I hope we'll come back to it. Great. Okay, with that, I'll hand over to AIM High's Marnie Somer and Bethany Caruso.
Thanks. So that was fantastic. We love the Mix 7. We would obviously like to see more, even more indicators included, but it's tremendous that it was done. And we were just kind of googly-eyed over what they're planning to do in Pakistan, including MHH in the DHS, getting MHH into the Education Monitoring Information System. Like, that's what we want to see happen. So the more countries that can do that, I think will be amazing models for the countries who are pretty far behind and need to catch up. So, plus he's a great guy. We hung out with him at the Mix 7 meeting this summer, and again, it really showcases to me how critical UNICEF and others are for really leaning into making sure we have national level data or regional province level, so we know what to do. So on that note, getting started. So if you were in your active gonna go make change world happen, wanted to get started with the AIM High indicators that Christy wonderfully mentioned, we thought we'd just do a really rapid kind of how one might get started, because obviously contexts are very different around the world and you have to think about how to adapt them. And one little plug I'd give, I know that this UNC conference is primarily focused on low and middle income countries, but I love that Ireland and Canada and some other countries are trying to step up and collect that data. It'd be great if the US did that, but anyway, it's a whole other conversation. Just to note, we used to call the group, which is this core group, and then a much larger group of amazing advisors from UN agencies and other measurement experts, the Global MHH Monitoring Group. So this is on behalf of that core group, which has now kind of become what we're calling AIM High, sort of architect for menstrual health indicators. So here's the indicator list, and Mallory on my team did a great job of printing these up. We're going to use them in a breakout group, I think. I'm not sure. I can't remember what we're doing today. But we have copies of the indicators, and these are all on our website as well. But just as you can see, there are 11 individual level indicators, 7 school level, and 3 government national level. We tried to make some a bit easier than others so governments could feel good about getting started, and then hope they will keep going. 5 of these were incorporated into the mixed monitoring data, which is fantastic. It's really wonderful to partner with them on this effort. It gets me a little too excited. But just we wanted you to be aware, you and whoever you reach outside of this room, we wanted you to be aware of the resources that have been put together over the last number of years with this group with a lot of help from others. So one is the priority list, which is the longest document. You just Google MHH monitoring and do Mailman, our school. We're going to have a better website one day, I hope, soon. But at the moment, it's on our website for lack of anywhere else to put it. It's in multiple languages, the full guidance, in case that's helpful. We didn't have the budget to translate the full guidance into lots of languages, but we did do a summary version in at least 4 other languages. And actually right now we're trying to figure out who in China. I happen to have a Mandarin speaker on my team right now and a Bahasa Indonesia speaker. Like, how often does that happen? So we're trying to figure out, our master students, who's doing what in these countries, and of course we'll reach out to UN agencies and others who can help us figure that out. There's also this guidance document because we wanted to be really clear about what might be useful in terms of using the indicators for folks who are doing more rigorous research versus those who want to measure or monitor sort of at the program level from a non-governmental organization or other organizations. So just to say, we purposely did this one pager. It's also on our website to help think about the difference in how you might use and adapt them for those 2 sort of kinds of work folks might do. And then lastly, we have slide decks to help you get started. These are quite extensive. If you go to that same website, which I think we may have a QR code here somewhere, I can't remember, you will see the PDF versions because our Columbia University doesn't let us post PowerPoints. But if there is a link that if you click there and enter your name, it automatically sends you the PowerPoints, because it was very clear to us folks may want like 5 slides. They may not want the full decks. So please go there, use it. If you have any questions, feel free to email anyone on our team. But just to say, there's one that's focused on training for the school level indicators and one that's focused on training for the individual level indicators. And now over to Bethany.
Thanks, Marnie. I'm just going to give a few examples of what's on those training decks so people have an understanding of what they can find there, because we haven't really presented on those in the past. As Christy talked about and also Ashraf talked about, training is really important. There are a lot of terms that are really important that people have to get on the same page as. But it's also really important that the enumerators... was that Ashraf?
It's okay.
Yeah.
He just muted himself.
Okay.
You're good.
We'll be back. That the enumerators also understand how to work with adolescents specifically, because the indicators that we shared are primarily targeted at adolescents. So this is just an example that's sort of peppered throughout at various stages of the slide decks. We have scenarios or opportunities for enumerators to talk with one another, get into groups and pair off. Key terms like menstrual materials. So menstrual materials, menstrual management materials, menstrual hygiene materials. This was a deliberate choice to have an umbrella term so that we weren't specifically and unintentionally making kids, young people feel bad about the specific choice of materials that they were using. So that is something that we help explain in the training as well. And an example of that from just one of the indicators, this is indicator 2. This is a school level indicator, so it's not featured in this. At the time of the survey, are menstrual management materials available at the school in case of an emergency? So you'll see that the guidance here shows that there's some, I can't figure out the lasery part. The key term is on the bottom, but there's also this note here that in order to verify this, this is not just being asked of the principal, they have to actually kind of ground truth and go and check that there actually are materials at the school so that we can be more confident in the data. Another key term is the last menstrual period. It sounds a little straightforward, but it's, what do you say if you're actually menstruating right now? Like, do you mean right now? Do you mean like last time? So we do have some guidance specifically for trying to help girls interpret what that would mean for them, noted right here on the bottom. And I just want to sort of think about some of the relationship and considerations for a mix in relation to these aim high indicators. As Marnie and Christy said, it's really remarkable that mix. Now, Ashraf talking about like incorporating all of these at multiple and different levels of data collection. So Christy noted that this is a sort of module, and it is complementary instead of now a core part. And so in addition for that being a choice, it's also a choice based on a cost. So there are some fees attached to it. So it's an opportunity for us to advocate and push for these data to be collected. Mixed engages those above 15. So we have all of these great data for people above 15. The inverse of that is that we don't have data for those aged 10 to 14, which is a really critical stage for young people and understanding menstruation experience through life course trajectory. Not all indicators are captured in the mix. The mix can't do everything. Even as a complementary module, there's just not enough room. So there's a real opportunity to think about other venues for data collection, specifically school level and even government level. But despite these few limitations, let's end on a very celebratory note. Wow, we have mixed collecting data on menstruation for women aged 15 to 49, and as Christy pointed out, the evolution of these indicators is only getting stronger and more sensitive over time. It's responsive, and not a lot of data collection leaders are responsive in that way, which has been really, really good. And that we reliably have reports on menstrual health from multiple report cycles. So we are able to see changes over time, even if there is some variability in those data and how they're collected. And this data is made accessible for decision makers, and it's been really amazing to see how it's actually been used and the vision through Ashraf of how it's going to continue to be used, and how the champions of the people who are using it through UNICEF and other venues. So thank you for that. I'm hoping that we can pass it back to Ashraf.
I will try and get him back on. Thank you so much. We can clap. All right, let me see if Ashraf is on here. I also want to put a plug in for those training decks. When we put together our proposal for mixed guidance and training documents, we literally had those aim high training decks on one half of the screen and then the UNICEF proposal on the other. So there's such good information there. You can use it for so many different things. Ashraf, can you hear us now?
Yes.
Can we go back to where we lost you? Can you see the screen?
Yes, I can.
Okay, I think we were...
I think we were on the second last one, by the way, but... No?
This one.
Yeah.
Yes.
All right. Okay, I'm handing it back to you.
Thank you so much. So the point, I think, where I've been lost is talking about the potential improvement and the potential of integrated the mixed data with the other data sources. And we mean here by the education management information system. So there's a lot of ideas that could be done. First, to harness the potential of the mixed data, but also to target, for example, some hotspot schools where we can do more intervention in terms of making the materials available for the girls. There is a lot can be done on that. Mix or Mix Plus. There is also another tool that Mix program has developed called Mix Link, where you can link the Mix survey, household survey with the other admin, different types of admin data. Next, I think this will be my last slide if I'm not wrong. Yes. So again, I think Pakistan now we've done two. We're going to continue to generate MHH information next year for the rest of the country. And again, there is another opportunity, as I said, to come up with a national level estimate for this. The good thing here that we don't put a lot of efforts in terms of advocacy for the model. So this is something that we're happy with it. So our energy, our efforts are more on making sure that the data would be used at the end for the benefit of girls. Yes, with that, I would like to thank you, Christy, and the colleagues, all of you.
Great, thank you, Ashraf. We appreciate it. And the next thing we have is actually a Q&A time. So if you have questions, especially for Ashraf, since he's not here in person, we'd love to take questions. It's an early morning session. Did we just inundate you with information? Rick?
So, Ashraf, thanks for your interesting presentation.
Wait.
Yeah.
Thank you.
Hi, Ashraf. This is Rick Johnston from the WHO side of the JMP. Congratulations on the great work you're doing in Pakistan on this. And gosh, if the DHS could happen and could integrate some MH questions in Pakistan, that would be fantastic. I wanted to ask you a little bit more about the kind of use of data, and I saw one of your slides was that you saw there's some potential to integrate MHH questions into the EMIS, and I think that would be quite interesting. I mean, often EMIS data are reported, kind of self-reported by a school administrator, and don't really tap into like student experiences or even inspections. So I wonder if you could speak a little bit about what you see as possibilities for integrating MHH into the EMIS and how those data might be used. Thanks.
Ashraf, could you hear all that okay?
Yes. You want me to address this? Okay. No.
Yeah, easy question, right?
Yeah, it's very easy. And whenever we say it's a good question, meaning that it's difficult. So, but no, it's a great question. I think if we are thinking to integrate, we need to think about this while we are designing the mix, not after we finish the mix. So the idea is that came up on the table is while we are trying to collect the data through the mix, we're going to also collect the names of the schools, and we create other IDs, identification of the schools and the areas where we are collecting the data. And then we're going to collect also the data about, for example, absenteeism of the girls and try to connect this with another data collection exercise, right? So it's a matter of first focusing maybe on one of the elements of MHH information and use this different platform. For the time being, maybe we missed this for Punjab and GB, but we can do something for the rest of the mix coming next year. But again, the integration is not going to take place at the level of the individual. It's going to take place at the level of establishment or institution, on which is the education in the case of MIS, right? So still ideas to be matured and to be also discussed, and also looked very closely on the terms of robustness of the methodology to be able to use it later on. Over.
Great, thank you so much, Ashraf. Maybe time for one more question?
Well, I just want to comment, I'm not a statistics or indicator person. I just look like I am when I'm up there. But just to say, the Philippines has been our poster child for years, and Jackie had a lot to do with that when her role at Save the Children, coordinating with UNICEF and GIZ, because they have had MHH in their EMIS for a number of years now. So although it may not translate exactly from the mix questions, I think it's a great model for, it may, obviously would have to be adapted for other countries who want to do that.
Yeah, your school level questions in the AIMHI document are great for considering for the EMIS. Yeah. Any other questions?
Thanks, and thanks to the presenters. I had a question about It's come up a couple of times that the need for advocacy to include the complementary model, and I was just wondering whether there had been any analysis of maybe some of the competing sectors or the potential barriers to that, or indeed the motivators that might encourage governments to include that model, just to inform the advocacy going forward.
That's a great question. I'm going to pass this to you, Ashraf, here in a minute, just a heads up. We haven't done anything that I know of formally. When we met in Rome, we heard from the 7 countries represented what their experiences were in trying to get the government on board. And in most cases, the government was like all for it, no issues, but it was being subsidized. So we don't really have data on government paying for that extra module yet, as far as I know. Ashraf, do you want to add anything on your experience working with the Punjab and GB governments around advocacy and using the module?
Yeah, Kirsty. I think what we have is we have very critical milestone before we start the mix. We have workshop where we invite the main stakeholders, the main users of the mix. And during this workshop, we assess the data gaps that we have. And during this workshop, stakeholders that just expressed that we need such data right now, and then this would shape the questionnaire, the content of the questionnaire. We didn't find any issues in terms of inclusion of this model, not a single issue. As I said, one of the criteria to inclusion or exclusion of model in the mix is the difficulty to implement this. So the statistical office usually lean more what we call this easy model. So there is no logistic, there is no procurement, there is no supply to be used in such model. It's not anthropometry where they have to buy scales and height and hire somebody to make. No. It's far from that. It's set of questions very straightforward, and there is no sensitivity as well as now perceived. There is no sensitivity. So that criteria is very strong. It has a strong weight in terms of inclusion or exclusion of the model. We didn't have any issue on the inclusion of this model so far.
Great.
Christy, can I just add one thing, although you all would know this better than me, just for those who are not familiar, because this was a learning process for me, for a country to do the mix, first they need to find the funding for the mix core. Then, if that is happening, they can do the complementary topic. In this case, I believe the Gates Foundation supported the Mix 7 in all the countries so far. I don't know that they will continue to do so, but that was one of the reasons we really wanted them to help open the session, because they really saw the potential for more MHH data and felt it was a way to help countries kickstart. Again, I don't know what will happen going forward, and DHS had started to do more, but we don't know what will happen there.
Yeah. No, thanks for adding that, Marnie. That's super helpful. And thank you for that response, Ashraf. That was really interesting to kind of learn more about that process. In the interest of time, we might move to small group discussions. Ashraf, you're very welcome to stay online, but we'll be doing the group work in the room. So in case we lose you or you'd like to go spend time with, not looking at a screen in your evening, then happy to say goodbye now.
I need to go home.
Go home. Thank you so much.
Thank you so much. Thank you so much. Best wishes for the rest of the session. Thank you.
Thanks. Take care. Bye.
Thanks. Take care. Bye.
Okay, small group discussions. We forgot to assign someone to moderate this, so I think since I'm standing up here, I'll just go through it. Great. We want to learn from all of you. We have a lot of expertise in this room on MHH, a lot of experience. So there's 3 questions. They're posed around the room. Number 1 is in this corner. How do you or could you use the data generated by the mix indicators? And there's some examples in case you're not sure what we mean by that. Maybe you have another completely different idea. The second question is over on this wall. How could you support additional data collection? So we have data for some countries. How can we get this out to more countries, including high-income countries? Use this module in other platforms, etc. And then the third one, I think this is the most challenging. How could you support gap filling in your work? Additional research, how do we reach this 10 to 14 age group? What does that look like? What are potential data sources? So we're gonna break into 3 groups, and one is gonna start here, one here, and then we'll just rotate through. Any questions on that? Okay. Can we just try our best to split up more or less evenly and go to the 3 different groups? You'll get a chance to do each one. So go ahead and stand up, go to any board you want, just try and spread out if you can.
Do you want to go to stage? Is that the one? Just like to stay?
I think so. Is that okay?
Yeah, totally. I just want to understand. Will they like bring it home in like 4 minutes or something?
Get there, maybe I'll make it a minute.
You're great.
Oh my God.
I know.
What did we just say? Okay, you're only gonna have about 4 minutes at each station before we rotate you. So hop, hop, start generating ideas.
I'm supposed to take notes. Gosh, I thought practice was really interesting. Plans for using the mix 7 and the DHS. But on the other hand, they didn't use the mix 6 at all. So what happened there? So ideas about how to use the data. In my mind, I can think about national level use. I can think about global advocacy use and research going in. But tell me what's the how do you see these data being used?
I guess for like NGOs or nonprofits that can kind of target impact and like prioritize certain groups or areas of the indicators that say materials need the most work or facilities or things like that, it can kind of target.
Yeah, and I think you certainly had to see what having the data adds that specificity to what was the change of one.
I think going on yours, I really like how you said they put about stakeholders together to say, here's what we have, where are the gaps, and basically they can buy in for them. Because I think this could be anywhere, like you can well it, or you were in transition to no monitoring, great.
Yeah, they didn't make 6 days. They just didn't advertise the fact that they had been elected, so no one, was aware of it.
I'm with Business Connect, and so we're not quite into menstrual health space yet, but we're learning about it and making social enterprise to sell products. So I kind of think about this as from like a customer perspective, understanding the needs of administrators around the world, being able to communicate with them, like not just documenting those that are working with their communicators, and I know right now understanding their shared history, but I know right now that their challenges.
So like the private sector role to fill some gaps that are identified with data? Or mobilize or inform private sector or
Do you want to write it? Yeah, communication behavior. How do we get the government to desire the research? Some of them do like maybe knowing.
Maybe we give this group
People are struggling.
just
And I always think about customer data is so valuable just to and I was listening to work with them and provide them value. Okay, solve their life.
yeah. The mix 6 module that the earlier questions were is called the unmet needs module.
Also, I guess how they use the mix 6 to inform the results to inform how the narrative could be more sensitive. That could just kind of
Yeah, thinking about next generation. Yeah. Or future evolution. Not like everything's done now, right?
There are opportunities at more granular levels to use mixed indicators, like for advocacy. So I think, there's, at least in the US, there's more of a focus on local government in hard times. And so I feel like even being able to use national level indicators to advocate for things at the local level or a state or regional level could be impactful in having these conversations, really kind of permeating these like multiple levels of government that different countries have.
So you said local level. One challenge with national data collection is it's big, it's expensive, you gotta coordinate, you have sample sizes and all that. But especially for advocacy, statistical significance is important. So you could do some small scale things at a district level and get some very powerful efficacy.
Yeah, exactly.
Yeah, start the conversation.
Well, and sometimes if you live, I live in the state of Georgia, which is a relatively conservative state. And sometimes if you can get action to happen in one state, you then can go to more, progressive or liberal places and be like, look at what we're doing. And this place that usually doesn't have buy-in and resources, and why can't you do that?
Yeah. Story about that conservative statement. We just held a training in Tajikistan where they're having a World Health Survey. And it was all in I guess. And our trainer went through the wash module and then came to the menstrual health module. And the trainer was like, oh, whoa, whoa, whoa. The translator, sensitive topic, Muslim country, let's just skip over this module. So, the translator, okay, right. But then there was a Q&A session, and the questions were like, what about that menstrual health module? So they ended up talking about it anyway. Yeah, so I think sometimes people assume that the topic is going to be more difficult to approach in the field than it actually ends up being. Okay, so let's see, any specific topics? I mean, Ashraf was interested in absenteeism, which is going to come not from the household.
Okay, 30 seconds, and we're going to ask you to rotate the list you're in front of.
Awareness or sufficiency or comfort seeking care, ability to manage pain, any of those lead up to something that could lead to some action? Because that's the challenge, like, why collect data if it's not going to lead to some action? Yeah, just recognizing that this is an issue, having data to say, listen, a lot of people are not able to manage the pain that they need to. Yeah. Oh gosh. Management.
How the government learned about the indicators through your programs and what motivators they have.
And especially the health sector, but every sector too.
Okay, time to rotate clockwise. Everybody rotate clockwise. Here we go.
Some sessions on that where they have like activities in the workplace.
Had trouble participating in work during the so we're wondering if that's like
Okay, Jackie's group needs to move. Okay, we'll keep that person, and then, but everybody needs to have a chance to comment on all three groups. Rotate clockwise. So no, that way, this way. And then April and Sophie over to Mariah.
I said the power's gone to your head.
So our first group was talking about different types of use or different groups using mixed data or more generally NIH data. So NGOs in particular or for advocacy purpose love the idea of being able to prioritize groups or specific topics that the data show needs and interventions. Appreciated this Pakistan example of talking about the data and speculating that the data exists and they show that there's some problems and that is a way to make sure that the data are used. And we had some discussion about private sector being able to mobilize so that the data could inform future evolutions of indicators. The point made that it doesn't always have to be done at a national scale. You can get very good advocacy even at a small scale, not specifically representative thing. And then we were just starting to talk about specific indicators that people thought could be linked to action. So there was support for the pain management, absenteeism ones as being topics that could link to some actions around motivating the health sector or other partners to enable pain management and recognize that as an issue. And that especially for working schools. Does that resonate? Are there things that people want to add onto that list? Any experiences that you've had or that you, ideas that you have about like if in your work area MHH data like the mixed ones were available, what kind of actions would that allow? Because one challenge with integrating indicators into big mechanisms like the mix is if people don't end up using them or acting on the basis of the data that they get wrong, then they're not.
I think some of these businesses to inform policy. This was all a long time reports. I thought, so is there a law where you questions and some educators when you decide the virus and to be to hygiene among the house? And so based on the data that we collected, we were able to select them to the national level in such a way that the data from which we collected was able to inform the behavior which was basically on the provision of menstrual hygiene to primary schools. So I'm thinking that maybe there's a lot of going to be able to do a mix country or some of the although it shares with us to get to that level, the answer is never that very young, like this data, we saw this when you were going to mix, just is something you can consider that. We printed it just shared data. So we have to get that would be like and we say that we didn't communicate just so how can they sanitary like that? And by the time that the government took contact us, but they didn't say the profits, people and the price was not reduced, and they took back the tax of the next year. But in the last year, we didn't look at any
they remove the testing, Lord kind of manufacture our products because they want Tanzania to produce a sanitary longer to they believe that can also bring in for yes, but for the exported plants, they are still having the tax. But we are still advocating, it's not an easy thing. Do you know everybody loves tax? Yeah. They love taxes, but I think the data is different.
Menstrual-friendly toiletries. And you have where it is. There were similar program officers. There's a whole bunch of questions. I'm filling all of your. About what we were doing. That's what I want to hear from you, but I guess I want knowledge of menstrual shock for minutes, where it's usable, low, or do you see the way around this, or another way to do it? Was there any division of these? Like I'm wondering, are the ones about that, or is it getting better?
In most cases, there's been less participation. But in most cases, younger women, 15 to 19, had a bit higher awareness, but not like, oh, 90%, this is just like an old problem. It's like fed for each. Kind of like you saw in Australia. Yeah, experience learned. So improvement, but not like.
It was the Department of Education.
And it's like African infant is something we find a girl, and it's without taking she's out of school. How do we arrange the schools there? It's linked to an SHG.
Always losing.
And in the, I don't know if this can also include the people with disabilities. Maybe we assess how much of the need have some awareness or information. And that
There's only one material, then it's just like you're talking about materials.
Okay. 20 seconds and time to rotate to your final group.
Sure.
And she also like I said, teaching high school girls and programs and as yeah,
If you share these data,
yeah, exactly. And then indicators for the monitoring and then share it. I don't know if you're working on this. Share
Okay. I know you're having wonderful, wonderful conversations, but we only have 5 minutes left for you to experience your next group. So, clockwise rotation, please.
okay, awesome.
Okay, just 5 minutes in these last groups and then we'll wrap up.
So, potential use of the data. We were discussing expanding monitoring, idea ideas to look at the absentees and stuff, but also note that they said that they didn't use the Mix 6 data at all, so what happened there? These were some like general ideas about groups or activities that could be done, not to them all. And then this side is more about specific indicators that people thought could lead to more specific actions. Like if there's a low awareness before menarche, well, advocating for inclusion in school curriculums and noting that not everyone attends school. So, open to you guys if there are things that you can add, the more general side or the more specific side.
I want to hear from you. Does it work in making where do you think that you could fit in with where she's saying, like, using the factors to show them that it should
Yeah, well, fundraising. I mean, it's related to advocacy, but it's kind of a specific use case. Especially the pain one, yeah.
just to tap into what you just mentioned about fundraising, they want the brand new well, they want ways to fund that, but I think it's more about how do you use these indicators, like how could another challenge something later to apply them, fulfilling the pockets.
Do you think like inadequate menstrual health has potential to be more dramatic of a hook than like inadequate hand hygiene?
I think so. I think depending on the audience, if they'll put them at the gym, especially if it's not numbered, we'll sometimes highlight examples.
Yep. Well, some of the experiences can be quite traumatic, especially the pain ones, but also the awareness.
No idea.
The number of girls that have no idea what's happening.
No idea.
That's very evocative.
In your note, or they know, adult children, the videos that's another big piece. It's how the family miracles that our children aren't, so that we're in the community, there could be some level of surveying and wondering if parents allow it, nonprofit.
So sometimes, yeah, we have a culture here
for other reasons, and so it would be hard to really differentiate, oh, you're not in data, right, just because you didn't feel like you're like,
Did you have enough problems? You know what I mean? Like I'm thinking of like Girls on the Run and how like they have like this whole social emotional learning program.
One of the other groups, absenteeism around work, also came up as a topic that could lead to action or stimulate awareness or actions on private sector, on behalf of private sector partners.
That was one thing actually I had a question about from the questions that the Mix 6 and Mix 7 about impact related to participation in activities for school education. When you share that data back to your stakeholders, do you have a difficult time differentiating whether it's from pain or lack of materials or like a root cause of not being able to participate? I'm curious what your experience has been.
Well, first, in the Mix 6, work, school, and social activities were all grouped together, so we didn't even know if it was school or work or what. But in Mix 7, one, there's just been a few countries that have done it, and two, there's not a follow-up question about what was it that led you to not participate. And also, non-participation is not necessarily like assigning something bad. You know, maybe the ability to not go to work when you're experiencing pain. So I think that was still involved. Do you have anything to say about
No, you do that beautifully. I mean, it's only can do so much, right? It's 6 questions. I think one thing that you learn is that the data generated in other countries is for other countries. Maybe I'm sure it's out there. I know often countries are like helping mom with but I'm I'm hoping that the data stimulates engagement and interest, whatever the size looks like.
Nationally represented data is one use case that's important for like the JP and global monitoring, but we were talking about how you can have non-nationally represented things, data collection done at the local scale, very granular districts, and that can lead to really powerful advocacy that starts a conversation, which might eventually lead to something nationally represented. Maybe it doesn't have to, maybe that's enough. So we were talking about different use cases of this whole, goal monitoring, national monitoring. There's also research, like some of these questions about what really are the barriers. Maybe that's more suited to a research setting.
I hate to do this, but we only have 9 minutes together. We want to hear what the different groups kind of the highlights were. So we can go back to our seats and leave our spokespeople at each set of lists, and maybe they can share with us sort of the key highlights. I don't know who's managing this part of this, if it's me or Bethany or someone else. Share back. Here we go. Share back and synthesis. Is it this one? Yes. Bethany, where are you? You're doing this with me, apparently. Okay, so maybe we could start with question 1. Obviously, you've done some great work in a really short period of time, and you can't reflect on every single thing. I apologize to the spokespeople that they can't go in depth. But if we could just have even a little round robin so we can hear some of the salient points, and then we'll take photos, I think, of these flip charts so we can capture. So maybe Rick, over to you for the first question. What were some of the key things that came up?
Sure. Well, we had great discussions in all 3 groups. We talked in this one about different actors who might be able to use data. So there are, for instance, NGOs or groups working on advocacy that could influence policy. There's also, it was noted that there's value at even local scale, small scale data collection to inform advocacy. It doesn't necessarily need to be nationally representative. Even that can just lead to talking about the different indicators, the different issues that the indicators highlight. Starting a conversation like we see is being done in Pakistan, that is progress also. We also noted perhaps the private sector could be an actor that hasn't been thought of as much in being mobilized to fill gaps and meet needs, and of course to influence policy and raise funds, and that some of these indicators are very powerful and can stimulate action and also fundraising. We talked about some specific indicators that people thought could be linked to specific actions. There was a lot of interest in the indicator around pain management, and also just raising the issue that pain is experienced by a significant number of people during their periods. A certain proportion of those people aren't able to adequately manage that. That's not well understood. Absenteeism, both in school settings and work settings, is something that could also link to actions being taken by the private sector, by employers, by education ministries. And then maybe the last one was around awareness and people really supporting that indicator and feeling that when people aren't aware of what's happening when they have their first periods, that can be very traumatic, but it also points to some specific interventions around awareness raising, around inclusion of menstrual health in school curricula, but noting that not all children are in school, so that there should also be alternative pathways to reach that younger population, perhaps through community events, community scale data collection, and just to give a shout out for Menstrual Hygiene Day on May 28th every year.
Great. And I'm going to do a shameless plug. That was fantastic. We have puberty books. Vipindi vya Maisha is in Tanzania, in 10 countries to try and get at this 10 to 14-year-old age group, but obviously those who can't read need somebody to read it to them. Just one of the many things one could do.
All right, let me try and summarize the really rich discussions we had here in the group. We looked at how could you support additional data collection using these indicators to support harmonized monitoring. So actually we had a lot of people who don't necessarily work at national level, but have more engagement at local level through projects that they implement or programs. And it turned out that a lot of them are already plugging in some of the indicators in their own project monitoring, and they have questions like, where can we share the data if we think this is useful? How could we share lessons of collecting this data to further inform shaping the indicators and the guiding questions? And so Christy's there. We suggest that whenever you like to share it with the JMP, info@washdata.org. And definitely very useful. Christy's really excited to hear this. The other thing is that it's because it's such a cross-sectoral topic, we really have to ensure that we engage with all the relevant ministries and sectors when we collect data at the national level, because sometimes data could be collected through the EMIS or the HMIS or other mechanisms. So we have to make sure that all the different sectors are involved, and that even if one indicator is collected by one sector and the other one by the other sector, that it then comes together when we analyze and make decisions to prioritize funding or shape policies, for example. Yeah, I think I'll keep it here. There was more discussion, but in the interest of time, I hand it over to Jackie.
The only thing I'd also say, along with the JMP, is that AIM High is also hoping, if we get some more funding, to create a website to try and sort of outreach to folks so we can capture what different countries are doing. Not because we're going to do anything, but to try and, because that's not the kind of money we would have, but to help people find a forum for sharing. So just keep us in mind as well. Fingers crossed.
So I think our conversations kind of overlap with the harmonized monitoring conversations. We were discussing how you might be able to support gap filling. So recognizing that gaps might be, how do we reach that 10 to 14-year-old group that many surveys do not, most surveys do not. How do we engage new countries? And then also, like, how do we reach the unhoused? That came up towards the end of our conversations. So a few ideas. We were talking about that we don't just have to think about that national level data source. Maybe it is those programs. Maybe it is project monitoring, and that is shared locally with the government, and there's kind of a trickle up and a trickle down conversation where maybe at the national level there's a technical working group, and many NGO stakeholders are part of that, advocating for these indicators, but then maybe there's a lot of different NGOs or civil society organizations that are working with local schools or health centers to think about the school-based or the individual-based indicator collection and how that might be then shared up as well. We had a conversation potentially about, quickly at the end, was like, well, could we look at various vaccine distributions or rollouts and think about whether or not there's space to add on questionnaires in that moment. We talked about, there was a visit to the National Diaper Bank yesterday, and there was a conversation around, like, at that point, the National Diaper Bank locally seemed to have a lot of information about use, and missing, I guess use, right? I'm sorry. And what would happen is that the local organizations that were coming to it had to fill out information. So we're kind of thinking about different ways that maybe information might be collected. And then also making sure that many of these materials are, while they're publicly available, how do we get them out there and make sure that many researchers know about them so they're built into research projects as well. So that's a quick summary of what we covered.
Super. And I don't know what thank you, that was great, the National Diaper Bank thing was, but just to say for folks who don't work in the US, the National Diaper Bank Network is partnered, or same people started the Alliance for Period Supplies. And every year they have a conference, they coach grassroots organizations, food banks who are trying to distribute period supplies, and they do research and they track legislation around policy in the country. So just to say, I think they're terrific. I don't know if those things exist in other countries, but they would be a great source of understanding, sort of use if one were to tap into them, I think. And then in our final 30 seconds, over to Mariah.
Thank you. Thank you so much. I think it was a really rich discussion we had today, and especially also hearing back from Mongolia and Pakistan, who were able to share some of the lessons from their side. I just want to end saying that data really is power, and it can help us direct government and other funding and investment. And something we didn't speak about today yet is, for example, the WASH United Menstrual Health Funding Tracker that looks at where government spending for menstrual health currently is going. If you go into that data, you see it's all going to distribution of materials, a little bit to education, but not to anything else. So similarly, WaterAid, UNICEF, and the Burnett Institute with Julie Hennigan looked at progress in terms of policy in East Asia Pacific region. And we looked at what aspects of the menstrual health definition are covered in these policies. And again, it's mostly around menstrual materials, access to wash facilities, a little bit around education, but not so much on the other important parts of the menstrual health definition. And so I just want to say, if we're able to have more harmonized data that is nationally representative and can come up with global figures and global needs, we could inform global targets, we could inform policies and government investments, and I think that's why we're all here today. So I really want to thank you for the discussion and for your contribution. Share data and lessons with Marnie and with Christy because it's useful. And then before you all go for coffee, just wanted to ask, in case you're interested to build a shared agenda for action for menstrual health using this data and evidence and turning that into action, join us for a very brief discussion today in the afternoon. I have flyers, Jackie has flyers. We're gonna hang out in this corner of the building. I'm not sure if you're able to stay in the room, but we might be in the room next door with the round tables, and we're going to share more about the Global Shared Agenda for Action, how you can be part of that, and how we would like to engage with you going forward. So thank you again, and have a good rest of the day.
Come back here before you go.
Thank you. Yeah, great. Really good question for I realized I forgot until you were talking about it. You didn't get a chance to. Have you had